Hello friends, my name is Kevli and today I am here to discuss one paper that is Cryotherapy or Gradual Reloading Exercise in Acute Presentation of Rotator Cuff Tendinopathy, a randomized controlled trial that published in BMG Open Sports and Exercise Medicine in 2018. Rotator cuff tendinopathy is one of the cause for the shoulder pain. Excessive tendon stress can cause tendinopathy. Along with that, age, gender and lifestyle can also be possible factors. Possible treatment of rotator cuff tendinopathy is patient's education, rest, cryotherapy and gradual reloading exercise beginning with the isometric contractions. Cryotherapy will help to reduce pain and swelling. Gradual reloading exercise will help to inhibit rotator cuff tendon. In this paper, they mentioned they have mainly two questions. First is rehabilitation program contains gradual reloading exercise more effective than cryotherapy in individuals with the acute rotator cuff tendinopathy, and the second is what all this intervention will show effect on shoulder strength, shoulder range of motion and acrohumeral distance. Now coming to the methodology, they examined 44 participants at baseline at 2 weeks and at 6 weeks. They randomly divided participants into two groups, intervention group and control group. Each group has a 22 participants. In this study, they included participants who has age between 18 to 65 years with the unilateral symptoms of the tendinopathy and who had 3 months pain-free shoulder joint before the onset, before the intervention. In intervention group, they have to perform isometric contraction of shoulder lateral rotation and abduction 3 times in a day for 2 weeks. The hold of the isometric contraction is 20 to 30 seconds and the maximal force is 50 to 75%. In the control group, they instruct to apply cryotherapy like or ice pack with the cover with the towel on the pain site 3 times in a day, 1 time continuously for the 15 minutes. Now to compensate the shoulder movement, they instruct each participants of both the groups to perform gentle, slow and pain-free active movements of shoulder joint in all 3 pains. For example, flexion, abduction and extension. Okay, now coming to the outcomes, they evaluate symptoms and functional limitations with the dash, that is disabilities, arm, hand and shoulder, Western Ontario Rotator Cuff Index and brief pain inventory. For the shoulder range of motion, they used inclinometer. For the shoulder muscle strength, they used dynamometer, and for the acrohumeral distance, they used ultrasound. After 2 weeks of intervention, each participants of both group got a strengthening exercise protocol. But somehow some participants lost the follow-up at 6 weeks. But mainly the paper is based on the 2 weeks. Now coming to the result, they observed a significant difference in dash and Western Ontario rotator cuff scale and pain as well within the group effect, but there is no difference between the group time effect or time effect. So it means whether the person is underwent cryotherapy or gradual reloading exercise, both have a similar effect after 2 weeks as well as after 6 weeks. Now coming to the range of motion, shoulder muscle strength and acrohumeral distance, there is no difference within a group or not between a group or a group time effect. Now why the results are coming like this? There is one possibility is there. After the 2 weeks, they underwent the strengthening program. Somehow tendon healing is a time taking tendon healing is a time taking process. So with the time, maybe tendon will heal equally in both the groups. That is a one factor. Apart from that, in strengthening exercise, they didn't mention how much resistance they gave or which kind of strengthening exercise they provided to them for how much time. They just mentioned like strengthening exercise, that's it, and which movements they did, like a shoulder flexion, abduction they mentioned, but what is the 1 RM, 2 RM they didn't mention. First thing is that. Apart from that, the positive from this paper is we can use these protocols for acute phase of rotator cuff tendinopathy. For like we can combine both the things, cryotherapy as well as gradual reloading exercise both. We need to take for like some we need to take further research for the combined effect. So, to conclude this paper, there is equal effect of cryotherapy and gradual reloading exercise on acute rotator cuff tendinopathy. So, my suggestion, and I would apply cryotherapy and gradual cut. I would like to apply cryotherapy as well as gradual reloading exercise in patients with the acute rotator cuff tendinopathy. Eventually, both will help to reduce symptoms of that, so they can feel a relief and that will not worsen their condition into chronic state. So this is a helpful paper. They have some limitations, but still we can get something positive for the in a practice. So yeah, that's it. Thank you for listening me.